Hi, I'm Dr. Rajeswaran, consultant endocrinologist and bariatric physician, and I help people with endocrine problems and also with their weight management. So the topic for today is who should not take Wegovy. A lot of people know who should take Wegovy. That's if you've got a weight problem or a weight-related medical illness. And there are local criteria as well, in addition to national and international criteria. So today I'm going to talk to you about who should not take Wegovy. So the first one is allergic reaction. If you're allergic to any of the glucagon-like peptide class of medication, like liraglutide, tirazipitate, or the bidurian. So there are lots of medications of this class. If you're allergic to any of them, please do not take. And before your doctor prescribes this medication, please tell them that you're allergic to this medication and avoid having them. So the next contraindication, or those who should not take, is anyone with a history of medullary carcinoma of the thyroid or a family history of medullary carcinoma of the thyroid. But in fact, there's more research now that it's better not to take this class of medication if there is a family history of thyroid cancer. Because it's not just medullary carcinoma of thyroid. There are lots of other cancers as well. Though rare, there are different types of cancers. So I usually tell my patients, if they've had a history of any form of thyroid cancer or there's a family history of thyroid cancer, I don't prescribe this class of medication. Now we go on to the third contraindication, which is a personal history of pancreatitis. So if they've had pancreatitis, which is inflammation of the pancreas, I do not prescribe Ozempic, Wegovy, tirazipitate, or any of this class of medication. So another contraindication is type 1 diabetes. People with type 1 diabetes, they've not been studied well with this class of medication, that is Ozempic, Wegovy, tirazipitate. They've not been studied well. That is why we don't have enough information. But they can't be used for improvement in the glucose metabolism. Why is that? Because GLP, or the active drug within Ozempic, Wegovy, stimulates the beta cells in the pancreas to produce insulin. But people with type 1 diabetes do not have beta cells, so it's not going to be effective. At this point in time, this class of medication is contraindicated in people with type 1 diabetes. It's contraindicated in women who are breastfeeding or pregnant. I'll talk to you in detail in one of my other videos why it is contraindicated in women who are breastfeeding or who are pregnant. And in fact, you should be also careful if you're on oral contraceptive pills. This will be dealt with in another video, which will be released around the similar time. And then the next contraindication is severe gastrointestinal disease. For example, if you've got inflammatory bowel disease, you've had resected bowel loops for any surgery, you've got severe Crohn's disease, severe ulcerative colitis, or gastroparesis or paralysis of the stomach, or you've got some disorder where the intestinal movements are very slow, they got slow gut motility. I usually do not prescribe this medication for these conditions. That is inflammatory bowel disease, previous history of bowel surgery. What I do is I ask them to come in person, I talk to them, I really find out if it is suitable, because they can have complications. The next contraindication which I usually look into is severe renal impairment or severe kidney failure, especially stage 4-5 kidney failure. I do not prescribe. And the same with the liver failure. If they've got severe liver failure, they've got cirrhosis of the liver, I do not prescribe this medication. So, there's always some exceptions, but it's very, very important to discuss with your doctor. Sometimes it may be that someone is morbidly obese with a body mass index of 70, they're not suitable for general anesthesia. And what do? There's very few options. In that case, you should have a serious discussion with a multidisciplinary team of experts, and then this should be considered. So these are the contraindications of Wegovy. So what do I do before I assess my patient's suitability? The first step is I ask for a detailed history. So family history, their personal history, whether they're smoking, consuming alcohol. I also ask about any allergies, and ask them about all the medical conditions and medications they have been taking, and if they also had other weight loss medications. And then I also ask them about their daily routine, what do they do, the sleep timings, and the hunger pattern, bowel movements. So it's quite a detailed history before the suitability for these medications are considered. Okay, so that's for now for the contraindications of Wegovy, but this is applicable to Ozempic, Mounjaro, Saxenda. So you can, I think it's a similar sort of contraindication, and it's very important to stick to this. If in doubt, always consult your doctor. So if you are interested in any other videos, please leave the comments below. And if you've got any questions, I'm happy to answer. As I keep mentioning, these are educational videos, and these are in no way should not be considered as a consultation or personal advice. Take care.